Your biopsy results from surgery show a cancer. I think your best chance is surgery with possibly chemo, anti-hormonal, possibly radiation.
If anyone doesn't like needles, maybe tune out now.
I'm just so proud of Beck, the way she's handling this whole thing.
Yesterday's injection really sucked, if I'm being honest. It's painful! You know what would suck more? Not having little Eamon and Beck kiddos running around.
I just can't believe that they're trusting me with this.
Come on, little follicles.
It's just so inspiring to see.
Now the hormones begin. Oh, and we got a dog. We're used to it. Morning.
Hi, Pooh.
Good day so far. We're gonna have little babies.
Really?
You and me. Up to 8. Yeah.
8?
Yeah. So I had a really nice call with Dr. Velez this morning. She was so sweet. Her and I were crying, tears of everything together. Yeah. And essentially it starts with blood work for both of us today.
Both of us?
Mm-hmm.
Today?
Mm-hmm. Then I get up to 5, even more of my eggs.
Okay.
Then they...
What kind of injections?
I think it's like hormonal injections. Then after that, they're gonna extract, and then you're gonna provide your semen, and then they make an embryo out of that, and then they freeze the embryo.
Holy, I need a coffee, dude. All right, it's only been like 10 minutes later. We got a last-minute blood work appointment, so we're going to do that right now. Oh man, I still haven't had a coffee. Okay, this is stage 1 of the process here.
Feels good to be doing. I like doing and not just sitting and waiting, so we're doing.
I hope everything went well with the blood work.
I think it did, yeah. Gave them a bunch of it and a little pee sample, so.
Because you're already a week, maybe a little bit more into your cycle, the best approach would be to just make you ovulate whatever follicle you already have that's developing.
Mm-hmm.
Generally, if you're settled in terms of building a family together, and then you can't imagine anybody else being involved in that respect, then certainly embryo creation and freezing is the preferred method.
We're 10 years in.
We're committed.
That you would be responsible for it essentially would be a storage fee for the frozen eggs.
Okay.
Can we just use our own freezer?
No.
Okay,
Thanks, Doc.
thank you.
Bye-bye.
Bye.
Bye.
Well, things are moving quick.
Yeah.
Wow, that's a lot of information.
Sounded like a lot of positive outcomes, though.
Mm-hmm.
Yeah.
Yeah, I mean, it's overwhelming to think about. Anyways.
It's all good, baby.
Yeah.
If we're meant to have kids, we're meant to have kids.
Yeah.
If not, we adopt.
It'll happen. Of course it'll happen.
It'll happen, Beck.
Yeah.
Tell them what you just told me, buddy.
I came upstairs to tell Eamon that I just had another call with the fertility clinic, and she said to me, we need to get a sperm sample from Eamon, so you have to tell him that he can ejaculate today but has to wait until Monday. And it was like me and my parents on the phone, and my mom starts laughing, and she was like, oh, are your parents there again? We all had a good laugh.
Wait, so
Today.
what? It's my last day to ejaculate?
Yes.
And then I could ejaculate tomorrow?
No.
Oh, I just won't ejaculate today. Okay? I'll be fine.
It's very cold.
Well,
Man.
it's early in the morning, and we've got an exciting day. Going to make little baby Emmy and little baby Brio.
Well, we're going to see if we're potential candidates for it anyways. December 27th, and the journey really begins now, I guess, huh?
I need to
For fertility.
squirt in my cup this morning.
You do. Love you, buddy.
Look at that sunrise.
Yeah, it's been beautiful.
Please enter real information and fill in the COVID-19 assessment.
Been here before?
No.
Okay. Collect a sample in this container. You fill all the information here. This is sticker. You wrap around a container like this and bring back for me.
Collection room. Wow. Well, this is not where I pictured having kids.
12 seconds later.
Hello.
Hi.
Mission complete.
Done already?
Yeah, I'm quick.
How'd it go?
That's great. Nice comfortable chair.
So now it's my turn. I'm going in for an ultrasound. I hope I heard them wrong when they said it's an internal ultrasound, because that would mean they have to stick something up there. I think that'd be really uncomfortable. But I mean, if that's what I gotta do to have a little kiddo with you, that's what I gotta do.
Not quite as enjoyable as my experience.
Yeah. Okay, I'll catch you on the other side.
Bye, bud.
I will just say I'm just so proud of Beck, the way she's handling this whole thing. She's obviously, you know, struggling quite a bit, like lack of sleep, and I think she feels pressure, and which is totally understandable and normal. But overall, I would say she's handling this with the utmost optimism and positivity, and it's just so inspiring to see, because she doesn't deserve this crap. You know, she's such an unreal person. You guys know that. So it's a lot, it's heavy, it's exhausting, but you gotta look at it optimistically. What else are you gonna do? Been waiting in the car for about an hour. They're finally ready to explain to her what's happening. And I guess what's going on is they are giving her a bunch of medication to help produce more eggs. So I'm gonna go see the pharmacy and we're gonna review what all that means, because I think it's a little overwhelming.
Hey, Sam.
Hey, dude.
Come on in. So we're here to meet with the pharmacist who's gonna walk me through the next, sounds like 20 days of my life and medications and all that kind of stuff.
We just bought a lot of drugs. Whoa.
I don't even like taking Tylenol.
Usually there is just a different order for the medication.
Okay.
But since everything has to be done in a shorter period of time, so I'm going to go through step by step with you.
Okay.
Well, you're going to help with injections, as I understand.
Yeah, of course.
Great. So you're going to peel. You're going to clean with alcohol swab, and then you're going to just poke. These are the areas below the rib cage, 2 inches far from the belly button. So Ovidril is a similar pen. Next one, Luveris. Your dose is 75. They set you tight. So letrozole is a tablet.
Proud of you, buddy. It's a lot of information. You okay?
Yeah,
You're not alone, buddy.
I know.
I'm right here with you. I'll be with you the whole step of the way. We do it together.
Night one back at our cabin. We've got my entire family hanging with us. And we're about to do Beck's first injection. You ready?
I don't know, I feel nervous.
Baby, I'm like a trained professional. I've had the course and I'm ready to go. Okay, so this is like a little injection pen. And we take this and this just gently threads on.
God, I hate needles so much.
Okay, baby, so I've got your... It's gonna be anywhere here. It can be anywhere
There
here.
or
Yep,
here
no,
more?
it can be anywhere here.
This is where my skin comes out.
Okay, so it can be right here. Yeah, right there.
My whole body, when I know I'm getting a needle, can you feel how sweaty? I never sweat in my hand.
Really?
As soon as I see a needle, I have this like reaction.
You pinch and don't look away.
It won't hurt. It's a very small prick, honestly.
You're gonna feel a
Done.
little pinch.
And then we'll have a cup of tea. Well done, Dr. Eamon.
And you're all done. How was that, buddy?
Yeah, okay.
Yeah? Good job. Proud of you.
Thank you.
First one.
Now the hormones begin.
Wow. Good job.
Thank you.
Good job.
All right, today is day 2 of fertility injections. We're starting with a drug called Centratide. And Eamon's looking a bit concerned, which is scary because he's my nurse.
No, dude.
Whoa, do not touch your nose before administering a needle.
I just can't believe that they're trusting me with this.
Also, don't say that to your patient.
No, this goes in here. Mix that around. Is that good? It's not really mixed. You gotta do this for 5 minutes, so maybe.
Oh, okay.
Bonuses.
This one goes garbage.
Yeah, she shows it.
And then this one.
Yeah.
You ready, buddy?
Yeah.
We're going here.
Oh, sorry, I didn't know you were going now.
My buddy's so strong. She's so strong. She's so strong. Whoa, squirt it out.
Uh-oh.
Uh-oh.
Uh-oh. Hold it.
This thing popped off.
Uh-oh.
Now what?
Bye.
Thank you.
You're welcome. Bye-bye.
Bye.
We're all good.
Needless to say, things have been challenging around here, but I didn't want this video to get any further before I just stopped and thanked each and every one of you who have sent a prayer, a loving message, just your thoughts and well wishes to us. We feel them, we accept them, and appreciate them so, so much, so please keep that coming. I know that I mentioned in our last video, a big part of my healing is building a great team around me, and my therapist is an invaluable part of that. So I'm about to do my therapy call. Once a week I come into this bedroom, we call it the healing room or the sunshine room, and I just get to let it all out. For me, this journey is as mental as it is physical, and my mental well-being is so important, and I want to just stress the importance of mental health for everyone. So I reached out to BetterHelp to sponsor today's video in the hopes that you might take charge of your own mental health today. Many of you have heard me talk about BetterHelp before. They do an amazing job of assessing your needs and matching you with your own licensed therapist. They've helped over 2 million people start living happier, healthier lives and have over 20,000 licensed therapists on their platform. On BetterHelp, you can start communicating within 48 hours, and their services are available worldwide. My favorite part is I never have to wait in a waiting room or feel uncomfortable going to a physical location. I have literally done my last few sessions in bed. BetterHelp is offering our community a special offer of 10% off your first month when you go to betterhelp.com/EamonandBeck. That's betterhelp.com/EamonandBeck. I really hope that you get as many benefits out of therapy as I do, and just thanks again for being here. We love you guys. So Eamon is getting much better. We didn't have a slip up yesterday, we forgot to show you. I have my sister here to hold my hand, and we got Nurse Eamon ready to go.
I'm getting really good at this.
So this one has to be injected in my lower abdomen area. So we've basically gone right side, middle, and now we're gonna go left, and it's the last day, so hopefully. Woo! I actually haven't had any bruising here, but I do have it on my leg from the first day. If anyone doesn't like needles, maybe tune out now. This is a big one. Yesterday's injection really sucked, if I'm being honest, but you know what would suck more? Not having little Eamon and Beck kiddos running around.
And me embryo, guys.
Woo! It was way better. Yesterday was terrible.
Location yesterday?
Oh, why am I bleeding?
A little bit of blood. Good job, baby.
Job all around.
Thank you, everyone. Woo, another day. Today is January 2nd. We're a couple of days into my fertility journey here, and we start 2 new. Oh wait, no, I don't do them today.
What?
Wait, someone can come confirm. Eamon's all ready with the
January 2nd. You just have, it looks like you just have the pill.
Ah.
And this, and then on the
start
third.
on the third. That actually makes me really happy because I don't need to stick 2 needles in my belly right now. But I think Dr. Eamon was ready to rock, huh?
I'm not gonna say I'm disappointed, but I was looking forward to this.
Thanks for being ready, buddy.
Alright, well, rain check.
Okay. Okay, today is the next day, and we actually start injections today. So, 2 new injections, 2 new different types of needles.
Just reviewing the documents.
Oh, I can do this one on my legs?
Mm-hmm.
I'll put my shorts on.
So I dial it into 25. Yep. There's the liquid. And we're gonna dial in the dose. You're just gonna feel a little pinch and then you're gonna get your lollipop.
Right here.
Okay.
Done. Done?
I think I nailed it. That's it.
Good work, everyone. Woo! What's that? You missed a little?
A little drop came out when I pulled out. So that's Donald into our new friend, Lou Veras.
My goodness. Does anybody else's palms sweat when they have to get a needle?
Got every drop.
Nice.
But he looks so cute.
It does look cute.
That's it.
I didn't like that one.
It hurt?
Yeah.
Are you pinching too tight, buddy?
I don't think so.
Should I be pinching next time?
I don't think so.
I think you're pinching really tight.
I'm
Look
nervous.
You got a mark there.
I know.
One more day.
Only 3
Done
more.
and dusted. I'm sorry, buddy. I'll do better. I'll do better.
Another day. That's all I have to say. It's another day of injections.
How'd I do?
That was the best one in a long time. Just having a crying moment.
You just don't feel like doing this?
No, I don't.
It's
No, we're
Gerald
taking
Riggs.
the Maroni last name now.
No, we're not.
Yes, we are. Yes, we are. Then you inject yourself with some stuff.
You can inject him with saline. That does nothing.
Just every needle I have to get. Eamon has to get some needles too.
Needle. There we go. It's a good spot.
For who?
For any embryo.
Shut up about embryo. They suck. The stories I'm gonna tell them one day. I can't freaking
Exactly.
believe the battle it took me to get you here. But is this too high up on my leg?
Done.
Why did that take so long?
Yeah, it's hard to squeeze. I don't know.
Okay, it's done now. Woo!
Well
That
done,
felt
buddy.
like a really long time.
I know, buddy.
It's just beginning for me. The hormones are just... I'm just tired.
You can take the last name if you like. Little dinner and a hormone shot.
7 p.m., dinner and a hormone shot. I figure what you're gonna notice about me is how often I wear the exact same outfit.
Me too. 3 days in a row on this tee.
This is a new day, we promise. I just wanted to say to any female who is going through this fertility treatment, especially if you're doing it all by yourself, you are such a champion, and I'm so proud of you.
Yeah, I'm proud of you, baby.
You're rocking it.
Well done.
That was terrible again.
What do you mean it was terrible?
Maybe
It's
the
cold?
tummy ones just suck.
What is it?
It's
was it-
painful!
What do you mean?
Like it hurts.
Right now it hurts?
A little bit.
You feel cold? Is it too cold?
It feels like it's still got a needle in there.
Oh, just right here.
Stinging, yeah. Arrgh. Give me something to push on it. Where are we gonna put that one?
I don't know. You on your leg?
My legs are so bruised.
Fine, over here.
Do the other side.
Oh, guys. Usually around shot number 2, we start to get a little emotional.
I do feel really emotional. Like I don't want the second shot. I don't know where to put it on my body that I haven't already injected. There's just no space. He just knows to ignore me now.
Done.
Nailed it.
Look, not even a mark.
And
Didn't hurt. I was just gonna show them these Hasselback potatoes. It's nothing to do with fertility. Everything to do with my sister being amazing.
stick to fertility.
everyday eats.
Everyday eats. Mel thinks that she might be feeling the hormones I'm feeling because we're normally really in sync. You're the best, Mel.
Morning.
We're back at the Ottawa Fertility Center this morning for an ultrasound and some blood work. I think and I hope that today is like sort of the last checkup before the egg extraction, but I'm not really sure what to expect, so.
If you need me to head into the collection room again, I'm capable.
So you don't have anything growing yet, but that's not abnormal for the first ultrasound, okay?
Okay.
Because it's very early.
Okay, thank you very much. Okay, based on my ultrasound this morning, we are upping my dose of both the gonal and Luveris. Eamon's just done a little mixing. He's a mixologist of sorts.
Those guys are done.
You're amazing, buddy.
He is amazing.
You're actually the one that's amazing.
We're all amazing.
These are your pills.
You're amazing. No, you're amazing.
Oh,
Kids
no.
better appreciate this. Your mother's doing a lot just to have you.
Yeah.
Nice job.
Nice job, everybody.
We're all done.
We didn't cry today.
Woo!
Yay!
Big day!
Today is the first day since my news that we've been alone. It's also the first day we're doing these injections alone. How are you feeling?
Exhausted.
Yeah.
You know? It's just difficult, like, to stay positive every day. But I just have so much comfort knowing that we have each other, you know?
Some days I'm able to just be like, it's just insurance, we do it for the kids, it's not that bad, people do this all the time.
Yeah, that's what I always kind of go back on, but we're doing it for the next generation, bud.
And I have a really positive thing to share. Tonight we're having tacos for dinner.
That's right.
I should actually put the oven on for the corn tortillas. Like, how do we defrost things anymore?
Yeah.
We don't use microwaves anymore, too much radiation.
And we're back. She doesn't look that happy. Oh, she's smiling. She is happy. She's kind of happy. She's sort of happy?
Not there yet.
Oh.
But she talked me through everything and she showed me charts at the end. She's like, your eggs are growing, you're doing such a good job. She's so nice. I asked her if I could take video of it, but she said no. But she did give me a picture. Because I was like, really? And
Baby's first ultrasound.
yeah, I know. I was like, I've never seen someone get a picture of just their uterus without a baby in it. She says I have a very photogenic uterus.
You do.
I have a
It's
really healthy
beautiful.
uterus. And then these are, I guess you've never seen it yet. These are what you grow. These are all the little follicles, all these little black
Like
areas.
3?
No, this is just like an zoomed in. So like within every ovary, as she moves around, you can see like that's probably one. That's probably one. I have like 12 or 14 on every side, on each side. These little follicles here are what grow the little egg. No way.
What?
That was your best one you've ever done.
Thank you.
Thank you. Thank you, buddy. Good morning. Based on yesterday's ultrasound, knowing that I have follicles growing, I now have to add into our routine a morning injection. This injection has to happen at the exact same time every morning because it's what's going to stop me from ovulating all of the follicles that I'm growing, which is obviously super, super important. Shout out to Cetratide. So we're aiming for 9 o'clock every day.
Little darling, steer it up. It's a little foggy. Keep on steering, steer it up.
You are amazing.
Good job. Ready? 300, yeah? Tomorrow's the big day. Come in for another ultrasound. How are you feeling about it?
I'm feeling good. I feel like this injection is really actually gonna
Fire you right up?
fire me right up. We're hopefully near the end of this fertility journey. Overall, honestly, it's been not so bad. I have an amazing partner who's helped me with the injections and I think the hormones, because I'm dealing with such other intense emotions around a whole slew of other things, it's hard to separate whether I'm just highly emotional.
We're done. Let go.
You're being funny today. That was a big stab and you know it.
That was a kill shot.
I didn't like the kill shot.
Sorry, buddy.
Come on, little
Brio.
follicles. And then it's hard to separate, like...
Don't start telling them you're not highly emotional.
No, I am. I have been highly emotional, but I've also just received a cancer diagnosis, so it's really hard to separate.
Of course.
What is the emotion, so...
Of course.
Please don't be silly about this one, okay?
No more kill shots. I usually go in with the thumb, but my thumb's been hurting.
You were in, and then you moved it inside when you were inside.
A little bit. It's all over now. Done. You've been a good patient. Thank
Baby,
you.
you weren't a good doctor. Oh,
I'm sorry, buddy. I'm sorry, buddy. Buddy, I've been doing a lot of driving. I'll do better.
So...
Still hurts?
Just minorly.
You can speak to the receptionist on the way out.
Through our amazing friend Kirsten, I am now seeing these injections as I'm meeting them with a lot less resistance and with a lot more love. And I love that they give us an insurance policy on little Eamon and Beck babies because that's something we've always dreamed of. So. She is the most special human on this planet. Kirsten Nielsen Yoga, will link her below. You've probably heard us talk about her before. She's amazing. She does some great energy work and yoga and yeah, all the good stuff. Okay.
Do you want some dinner or do you want some smoothie?
Yeah, smoothie would be good, I think. Good morning. We're about to head in for our appointment and I'm bleeding this morning.
It doesn't mean anything yet, buddy.
Yeah, so at least we're going to the clinic now and we'll be able to have a better understanding of what's going on.
Hello. We made it to Ottawa. We are doing our centrotide shot here in the car. Sanitize the nurse's hands.
I'm feeling like I can't handle the emotion of this.
Don't you go blaming the nurse.
No, definitely not. I'm blaming my body. I'm just gonna do that either.
No, you don't blame your body, buddy. Sitting in a parking lot, mixing needles. Baby, no matter what's happened,
yeah,
we're still good. I still love you a lot. We'll figure it out, okay?
Okay.
Sending you a lot of good energy right now.
I'm learning how to receive all that kind of love and goodness because I deserve it.
You do.
Okay, let's go.
Any news is good news, baby. Okay, here she comes.
Hey, buddy.
Hi.
Spotting is normal.
Oh my god.
It has nothing to do with my eggs.
Dude.
What are they? Look. Hang on the fridge. They're growing.
How much is this a lot?
She's not sure if they're big enough for extraction on Friday, but they're getting big. I have a couple 15s. That means there's almost a guaranteed egg.
Why wouldn't they tell us spotting is normal?
I have no idea. I got in there, right as I got in, she's like, hey, I saw you were on the list. Like, I wanted to work with you again, right? And I was like, Shannon, I'm spotting. And I was like,
oh my god, that's such good news.
I know.
Babe. So this is the nurse calling us back to see.
So the doctor would like you to go one more day with the vet.
Okay, I'm out of Luveris. My parents have joined us at the cabin. Moral support. We're all having dinner, but it's now time to take my injection. So
then the solid has to dissolve.
So what you're seeing for the camera is Eamon's doing his mixing of the drugs.
She's doubling her dose, so we're actually mixing it twice. She's getting two.
In two different bottles though.
In two different
same,
needles.
Nope, same one.
It's a good thing you passed grade 12 chemistry.
I don't think I did actually. A lot of pressure over here.
Way to go, Eamon.
Did you hit the cup?
done. Let go.
That was
Way
great,
to go.
Is that a good one?
Way to
That's
go,
good one.
Eamon. I was very impressed, that whole process.
Yeah.
Good for
You
you.
did a great
He's
job.
amazing.
Yeah, good
All
for
right,
you.
one
I'm
more.
gonna cry. You are amazing. Oh, I'm bleeding. You're not so amazing.
You're not supposed to bleed?
No, I think it's normal.
Oh.
Champion.
You know the video of Phoebe? I always think of that when she gets implanted with her embryos. Are you in there, little fetus? In 9 months, will you come greet us? I will buy you some Adidas. Tonight is hopefully my last night of the full injections. Pretty excited about that. I don't think I shared that I went to the doctor's this morning, which that's what happens when Eamon doesn't come with me. My mom and dad left the house with me at 6 a.m. Thanks, Mom and Dad. Love you guys.
Hey, bud.
Hello.
Hi. So I'm not quite ready yet.
And my follicles weren't grown enough to trigger today and have my egg extraction tomorrow, which we thought they would be. So anyways, another day of Nurse Eamon. Oh, and we got a dog.
Foster.
Yeah, we're fostering Oso. Oso, every night I sit here and we do injections. Is that okay with you?
Let's go, patient. We're
What do you
live.
think? Okay.
Ready, buddy?
Yeah. Scraping the bowl for more food.
Come on, dude.
He's licking it. He's so hungry.
In, come on.
Go ahead, buddy.
Go in.
Come on, Brutus.
Come on.
Stop calling him Brutus.
I think you're gonna be able to get him in there.
You're not getting the treat until you get in here. Come on, good boy.
Go in. Come on. Go in. Good boy.
Oh.
Good boy. Stay.
Good boy.
Good boy. Good boy. Okay.
Here's your treat. Here's your treat.
Stay. Good boy.
Good boy, Oso.
Good boy. That's a good boy.
Good boy.
There's gonna be a lot of good boys going out
Good
today.
boy. Sit. Baby, sit. Sit.
Yeah, good luck with that one, Dom.
Good boy.
Good boy. You smell so good already.
Good boy. Good boy.
Good boy.
Give another towel back.
Who's my good boy? Oso, show me. You look so handsome. You look so handsome, Mr. Wet Boy. Eamon, bring one of those towels up here. His paws are soaked. So my mom and I are here in Ottawa. She's come in for an appointment with me. So for years and years and years, I've thought about getting front fringe because I just think that could be fun. But I'm so low maintenance with my hair, I thought I'd really hate it after a while. And seeing as I'll be losing my hair anyways, what better time to get some front fringe? So we're off to get some bangs. I'll look like you. Yeah. So 2 reasons we're initially a little concerned. They had availability straight away. And 2, we can't find this place anywhere, so. You don't see bangs? There they are, hold on. Something like this.
Oh, it's cute.
Nice, eh?
Looks good.
Cute with my hair up, with my hair
looks
down.
cute. Yeah.
Yeah, I like it. She was like, oh my God, girl, my grandmother's had this 4 times. You got this.
Oh.
Yeah, what do you guys think? It looks good.
Cute.
We didn't even make it to this late on New Year's Eve. This is the latest we've been up in a really long time. Today is a very exciting day. It is my last injection. It's a new injection, and this needle is going to what they call trigger the eggs from my follicles to go from the follicle walls into the center so that in 2 days' time I can extract all of that liquid.
We're near the finish line, guys.
I'm so proud of you.
Me?
Yeah.
I haven't done anything. You've taken this like a champ. Like, I remember the first time we were listening to it all, it was just so overwhelming, and here we are near the end. It's very exciting.
I haven't been properly trained on this. Beck just kind of explained it to me, but I'm pretty much a registered nurse now. So I'm just getting 0.6, right?
Yeah.
Ready, bud? Is this the last needle ever?
Not for me.
Well, of this journey? Ready? 1, 2. Did you notice her new bangs? You look amazing.
Well, you know what I have to do tonight?
Beck has never been that good at digesting liquid she doesn't like. She eats basically anything, but when it comes to even like a warm drink, nah.
Oh, my whole tummy is I have to do this whole bottle. That's 2, I think. Oh my word.
You can do it.
For the children.
Take a drink. Good girl.
Thanks, Bob. For the children.
Here, let me try it.
No.
I'll try it.
Oh, don't you.
It's not that bad. Drama.
Well, we made it.
Thanks for driving.
Today's the big day. Beck's going in for surgery.
I'm so crampy this morning. Imagine it's like your one follicle cramping up when it's ready to ovulate or whatever. I've got like 20.
Let's do it. Oh.
This cramping is so bad.
Like the sample the same way you did before here.
Yeah.
And fill all the information here.
Yeah.
Okay. There are 2 rooms available.
Thank
So
you.
lock the door.
Thank you. Okay. Well, my job's a lot easier than Beck's.
Okay, procedure done. It's 11:30. I'm gonna get changed and head out.
Still see, can't get it out of my mind.
Morning, buddy.
Sit. Oh my gosh.
You going out, bud?
Are you coming back in? Or are you staying out? I was trying to drop a poo, but the snow's too high.
He's such a good boy that he waits to go outside to poo.
Look at him, buddy.
Oh my gosh, this is the biggest snowstorm we've ever had.
Yeah, this is by far the most snow we've had. Probably gonna have to shovel the driveway twice. How are you looking, PJ? All cute and that with your bangs?
Today's a PJ day for me, I think.
For sure.
I've been holding in everything. I just wanna say the words out loud.
This is gonna take a while. Gonna work at it piece by piece. Might switch and start over to the driveway. Come on. I need help, buddy. Come on. Good boy. Hey, come on. Good boy.
Gravity holds the key for me now.
So today is going to be a loungy day for me, but I thought while I'm lying here recovering, I would just kind of share a little bit more detail about the surgery and how that all worked. So I was hooked up to an IV. I didn't go under, but I was sort of put into a hazy kind of coma-like state, I would say. I heard what they were saying and I could very much feel some of the pain, but I don't, to my recollection, think I was screaming or saying anything. And essentially what they have to do is go into each of those follicles I grew, and they find them using the ultrasound machine, and then they use a long needle and they have to like pierce through and extract all of the liquid from the follicle. So within the follicle is the egg, but eggs are microscopic, so they have to remove all of that liquid and then extract the egg from that under microscope once it's out of my body, which is crazy. I had 14 extracted yesterday, and I'm definitely feeling lethargic, but crampy, but different kind of crampy than I did yesterday before the procedure, because that was pretty intense. She actually said that if your ovary is normally this size, mine were the size of 2 small watermelons yesterday. So I was carrying 2 small watermelons worth of liquid and everything. So yeah. Feeling really proud of my body, really grateful that this kind of science exists, that we have this insurance policy on our children, because treatment and the cancer treatments I'll be going through could really disrupt our fertility chances. And then I'm also feeling kind of emotional. I'm sure like I'm coming off of the hormones, but having this phase, this little part of the journey done, means that I've really got to put on my big girl pants, because up next is chemotherapy, and that scares me even more than all of the injections and hormones and fertility stuff, of course. So I'm just taking a day today. We're just taking a day. We're going to take it day by day.
No, that's okay. You have 8 embryos.
8 embryos. Awesome.
Yeah, so those are going to continue to grow. They'll grow in the lab till about day 5 or 6. And then you'll get a call in about a week to let you know how many of those were frozen. Not all of them will fertilize.
Oh, okay.
So, yeah, they just didn't successfully fertilize, so they just get discarded at that point.
Okay, gotcha. All right.
I would say, about 2 to 4.
Okay.
2 to 4 will make it, or 2 to...
Yeah.
Oh, wow. That's amazing how little, like, make it out of that. And then from the 2 to 4, it's like each one of those is a 50% chance that...
It'll carry.
It'll become a pregnancy. Wow. Okay. Okay. Thanks so much. I'm having lots of water. I'm drinking green juices. Sorry, my partner's here with me too.
Hi.
In case we get any news. The nurse is currently checking to see if they have an update on how many frozen embryos we have. We were supposed to hear 2 days ago, so.
We started with 8, right?
Come on, baby. Give me 5.
Give me 6.
Are you still there?
Yes, I'm here.
Number 558. Number of embryos frozen, 5.
Oh, great! I just had this gut feeling it was 5. Isn't that funny?
Yeah, that's crazy. 5 is a great number.
Thank you. Yeah, because earlier in the week she said 2 to 4, so this feels like just a bonus. So thank you.
Yeah.
Good news.
Congrats.
Thank you.
Sorry.
Okay, have a great day. Yes.
Those pink paws. Whose paws are those? Good boy.